My name is Dr. Luyten. I'm an emergency physician and I'm the medical director for Cascade Training. I'm here at our offices today and was asked to talk about sort of if I could say stop doing that thing or please do more of that to my EMS colleagues, what would I say? And we thought about this and we came up with a bunch of different ideas. I would say one thing that I would really encourage people to do more of is to take the time to get the medications on the patients. And I think there's sort of a myth out there sometimes that persists in some places that you can't bring the meds in because the hospital will lose it, or we'll have to throw them out or something like that, and that's not true. It's an incredibly effective tool and a big help to us in the hospital team if you can simply bring in the medication bottles. In our ER, for example, at Swedish, we have pharmacists who will take those medicines, go over them, and do kind of a pretty detailed, comprehensive medication reconciliation based on that, and that really improves patient safety and improves patient care. And I think a corollary to that is not infrequently I'll have a patient brought in who's maybe they're a little altered or they're just really frail or having a difficult time giving us a story, and I'll ask the medic, I'll say, hey, who's at home with him? Who called 911? And they'll say, well, his wife. And I'll say, well, is she coming in? And the medic will sort of go, yeah, I think she's coming in. And then we don't have a number, we don't have any way to get a hold of them, and it can be pretty difficult. So sometimes being really clear if there's someone coming in behind the patient, or if not, which is fine and may not be feasible, get the contact information for the next available person, because that can help us tremendously. We might have to make a difficult decision about an intensity of care or an invasive procedure that really might not be appropriate depending on what's going on with the patient. So getting that contact is incredibly helpful for us.